Hi everyone! Welcome back to my channel. So today's video is going to be about my 4-month post-op update as well as receiving my before photos, which we will get to the before photos a little bit later in this video. I knew receiving my before photos was going to be an experience. I knew I was either going to be really happy or a little uncomfortable. So it was this past week and I had a post-op scheduled. I know my post-ops seem to be really close together, a little bit more than other people's, but I was having some complications. My scar on my right breast had opened up, and I'll link that video down below talking about my blister and complications. So the post-op was to check up and see how that was going. I went to the office and, you know, did the normal. I was waiting for the doctor and then he came in. I showed him my blister, or lack of one. He, checked me out. He was feeling around. He said they looked really great. I noticed that he had my before photos in his folder, which I had asked for these 3 months ago maybe. On the right breast, on the scar going from the nipple to the crease, I've been having lumps. I'm trying to figure out how big they are. They probably range from a marble. Marble would be a good, you can't feel them if you're like grabbing my boob like in a sexual way, but if you like poke the boob you can feel them, which I mean in an intimate situation, who's just gonna be stabbing my boob with their fucking finger. So they don't bother me a whole lot, but they are kind of weird and blah. So I asked him what those were, and they were what I hypothesized, which, I don't know. Whenever I figure out something before I go to the doctor and he tells me that's what it is, I'm like, hell yeah. But, so what they are is stitches that have not dissolved yet that I have formed scar tissue around. He said they're going to dissolve within a year and they're most likely going to go away. Massaging them can maybe help them go away a little bit faster, and if they don't go away he can cut them out, but he usually doesn't do that because then you have like a missing chunk in your boob, which I don't want no more shit to be done to these, man. I'm over it. Anywho, so they checked me out, whatever, then he left the room and left the nurse with me. It wasn't Kelsey this time, it was a different woman, but she was nice, and getting ready to take my after photos, which super happy about. So, I just took the after photos in the same position. I don't have the after photos, I'm just gonna show you in video what they look like now. And when she opened up the little paper with my after photos, she hadn't seen me before. She was like, oh wow, you got a really good result, like really good result. Wow. She kept on saying wow. And I was just like, fuck yes, queen. Sorry, I'm feeling a little ham today because of my glam makeup that I did. Anywho, sidetrack. She really liked my result. I fucking love my result. Then I got the after photos. She left the room. I got dressed. I opened them up and instantly started shaking. Instantly I started feeling a little bit sick. Like, I was immensely grateful, but I kind of reverted for a second back to that little, I feel like I've grown so much, I refer to myself as like a little girl of just like that little insecure pain body girl around her chest. I just felt back to where I was, and I was like, oh fuck, and I closed that shit up and I put it in my purse and I was like, whew. So I left the office and went back to my car. My sister ended up calling me and we went out to lunch, and I just was feeling so weird about it. Feeling so odd, feeling sick, and feeling weird and insecure again which I was just like, bitch, snap out of this. You are a strong, independent woman. You can handle this. Fuck these tits. And I am a new woman, you know? And I feel like I am who I was supposed to be. And nothing is wrong with any type of breast. But I feel like the breasts that I have now fit me. Like, they're the ones that I was supposed to be born with, you know? And I feel the same, just a little side note, I feel the same about all body mods. People who get body mods do it to make themselves feel more comfortable. I get tattoos because when I have a tattoo, it makes me feel more like in my skin than without them. Same with people who really enjoy piercings, people who enjoy all types of surgery, whatever. It makes you feel more you. I'm going to tell a little story now about New Year's Eve. This is related, don't worry. Sorry, this video is all over the place, but so on New Year's Eve, it was the first time my blister had healed, and it was the first time that I was going to wear an underwire bra. Push-up, no less. So I haven't gotten to buy a bra for my new boobs yet. I'm going to show you the bra that I wore every day, all day for 2 or 3 years. I know it's kind of gross, but you know, oh well. The only bra that I had was that one, so I wore it on New Year's. And this is it. It is a Airy Drew bra. They don't sell these anymore, but look at how padded this is. Look at this. All of this. All of this. Look at how much padding. There's barely any room for your boob in here. It's just incredibly thick. Really thick padding bra. Gives you great cleavage. But it didn't used to on my boobs, but it does now. And this is a similar feeling to what I felt after I got my before photos. I wore that on New Year's. I had rockin' cleavage, everything was awesome. But what I felt on the inside, I didn't feel confident. When I used to wear that bra with my tuberous breasts, I felt almost like I was lying. My boobs, everyone thought I had huge boobs because I never took it off. Everyone thought they were like double D's or something. There were C's. One was like barely fitting in the cup. And all of the shape, all of the lift, all of everything wasn't real, which referred to my tuberous breast journey when I talk about finding your confidence and when I stopped wearing that bra. Even though I had my surgery, I still felt like I was lying. I felt like that little insecure girl again wearing that bra, even though the boobs on the inside were real. I realized that that was a huge pain body for me. I'm donating that bra. I probably should throw it away, to be honest. It has like face paint stain all in it, and like it's fucking old and falling apart, and this used to be nude and now it's like a lavender color. But fuck that shit, I'm throwing it away. I am a new me, and that was part of bringing back my pain body. And getting these photos, I felt the same way. And these are just raw emotions here. I'm not saying they're rational. I'm not saying that this is how you should feel. Still is such a weird feeling, and honestly, I don't like looking at them a whole lot. I don't like looking at my after photos and analyzing because, you know, I know what they were like. They were on me for 20 plus years. You know, I don't need to look at them all the time to feel grateful for what I have, you know? And what I am going to try to work on personally, and through the rest of my tuberous breast journey, what I want to do is I want to look at these photos and I want to feel okay. I want to feel confident, and I don't want to loathe them. I don't want to have resentment towards them. I don't want to revert back to that little girl. So that's my goal. I want to be able to show these off and not feel weird about it. And I have made steps towards that. I didn't hide these. I was so tempted to get these and shove them in a drawer and ignore them. Not show anybody. But you know what? That's not what my journey deserves. That's not what I deserve. I don't want to hide anymore. You know, I thought about not showing my 4 pictures at all. I thought about linking them to a separate website so someone would have to click on a link to be able to see them. But you know what? Fuck that. Fuck hiding. I'm gonna show these on video. Obviously, I'm gonna have to blur out the nips so that it can be available to everyone in this video and not get flagged. But I'm not a victim. I'm not afraid or scared or insecure about who I was or who I am now. And I'm ready to help people. Help people like me. Help you with your situation. And how I'm going to do that is by showing me. So someone can have something to relate to. So you can have something to relate to have your breasts. And that's what I wanted. I wanted so bad. I heard people talk about their tuberous breasts. I heard, you know, blah, 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 they're describing them, their after photos, whatever. Okay, but what were they like? You know, all I ever wanted was to see a woman with something similar to me. And I couldn't find them. Still haven't found one. I found one girl on YouTube. And it was before and afters, and it was a surgeon's video. It wasn't her. But I am here to say, I am Lindsay, and this is who I am. This is who I am. This journey is who I am, and what I have now is who I am. And I'm okay with it. And I want to help you. I want to help you find support and someone to relate to and someone to help you on your journey. And the only way I'm going to do that is being by completely open, honest, and raw. And so without further ado, here are my before photos.
Alright, so as you can see, the your left, my right breast was quite a bit smaller than the right one. Right here you can see the kind of triangular shape that they had. And in this one you can see the droopiness as well as how little underboob I actually did have. This is a really good example of the constriction on the top and bottom at about 3/4 of an inch of underboob on that side, and this is another side view.
So now I'm going to show you the after result. Now my nips have been really dry and I'm trying to moisturize them. Ignore that. So here's the front. I obviously have to cover my nips. I guess I could do it with 2 fingers. Okay, so this will probably be better. Do you see how much side boob I have? Isn't that fucking crazy? Look at that. Look at like this. I fucking have side boob. Isn't that awesome? These are how are my scars doing. This was the one that had the complication. But they're doing pretty good. This is just about 4 months. Now, you know, they can be pushed up and stuff. This is just like full resting. Also something to consider that this space in between your boobs will not change after a boob job. So this space, yeah, you can like push them together and shit and like push up the implant, you can see that. But this space is not gonna change. So however far apart your boobs are, which mine were really far apart, and they're far apart now. No, they're not jacked up right now. You know, they can be like crazy cleavage if I wanted to, right? Like shelf status. There you go. Also, you can look in my blister healing regimen, which I will link down below, and you can also see what my boobs look like. I am wearing pasties in that video, and obviously I have a blister, but you can kind of see what they look like. You can kind of see what they look like without me holding them in that video. Thank you so much for watching. I really hope that you got something out of this video. If you did, make sure to leave a like and subscribe down below. I'm going to be doing way more videos related to this tuberous breast journey topic. I love support and I'm here for you guys. And just remember, love yourself.